You probably think your heartbeat, your digestion, and your breathing are like three completely separate systems, right? Just running on their own tracks.
Yeah, that's what most people assume.
Right. But what if I told you there is one single sheet of muscle holding them all hostage? Like a moving border wall inside your body that dictates literally everything. From the rhythm of your pulse to whether or not you get heartburn. So welcome to today's deep dive.
It really is the ultimate dynamic boundary.
Yeah.
We're looking at a piece of anatomy you rely on every single second of your life.
But probably never think about.
Exactly, you never think about it. And our goal here isn't to just, give you a pop quiz on Latin medical terms. We want to show you the architectural marvel sitting right in the middle of your torso.
Yeah, our mission is to take all those dense anatomical details and, well, turn them into a clear mechanical picture for you.
Right.
Because by the end of this deep dive, you're going to understand not just the what of your internal anatomy, but the why.
Yeah, mechanics behind it.
Like why your trunk is structured the way it is, the brilliant physics of your own breath, and how this one constantly moving dome shapes your entire physical lived experience. Okay, let's unpack this.
Sounds good.
We have to start with the foundational architecture. Before we look at the crowded neighborhood this muscle lives in, we need to know what it is and how it actually moves. So the source material describes the diaphragm as an unpaired, dome-shaped skeletal muscle.
Let's break those terms down because they build a really clear mental model.
Okay.
Unpaired simply means it stands alone. You have 2 biceps, 2 lungs, 2 kidneys, but only one diaphragm.
Just the one.
Right, and dome-shaped is it's the perfect visual. Imagine an open parachute.
Oh, yeah.
Or a pitched tent situated completely horizontally across the middle of your torso. And that term skeletal muscle is crucial here.
Does it mean voluntary? Right.
Exactly. It means this is the exact same type of voluntary striated muscle tissue as your hamstrings or your calves.
Wow. Okay. So it serves as a physical barrier.
Right.
It completely seals off the bottom of your rib cage, separating your thoracic cavity.
Your chest.
Right. Your chest, where your heart and lungs live from your abdominal cavity below, where your stomach, liver, and intestines are all packed in.
Yeah, it's a total seal.
But a barrier that moves constantly has to be anchored incredibly well. Where do the edges of this parachute actually tie down?
It anchors to a complete 360-degree circle around the inside of your trunk.
All the way around.
All the way. In the front, the sternal part attaches right to the back of your xiphoid process.
That's that little bony dagger at the very bottom of your breastbone, right?
That's the one. And from there, the costal part sweeps around the sides. Costal refers to ribs, so it's literally gripping the internal surfaces of your entire lower rib cage, ribs 7 through 12.
Okay, so it's grabbing the front bone and the side ribs. What about the back?
The back is where the architecture gets intense. The lumbar part doesn't just rest against your spine. It digs its roots deeply into it. It grabs onto the upper lumbar vertebrae, so the bones in your lower back, and interweaves with the thick ligaments running down your spinal column.
Wow.
Every single time you take a breath, you are mechanically pulling on the bones and ligaments of your spine.
That is a massive footprint. Front, sides, back, all gripping bone. But here is the fascinating structural twist that the text mentions. All of those muscle fibers originating from the edges of your ribs and spine travel inward, upward, and insert into the exact same place in the middle.
Yep, the central tendon.
The central tendon.
It's essentially the peak of the parachute, but instead of being muscle, it's a tough, flat fiber sheet right at the top of the dome.
Because muscle fibers can only do one thing, right? They contract and shorten.
Exactly. So when the muscular edges of the diaphragm contract, they all pull simultaneously on that central tendon.
Which brings us to the core mechanism of breathing. Think of a giant fireplace bellows or like a medical syringe.
Right.
When the diaphragm contracts, pulling on that central peak, the dome flattens out and moves downward towards your belly. When you pull the plunger of a syringe down, you increase the volume inside it too.
And that volume increase is the entire basis of human respiration.
Really?
Yeah, by flattening out and pulling downward, the diaphragm vertically stretches your thoracic cavity. It literally makes your chest bigger on the inside.
Like Doctor Who's TARDIS or something.
Basically. And physics dictates that when volume increases in a closed space, pressure drops. So the pressure inside your lungs falls below the atmospheric pressure outside your body, creating a vacuum.
And air rushes in through your nose and mouth to fill that vacuum.
Exactly.
So you pull the bellows open, air is sucked in. But you don't even need muscle power to push it back out, do you?
No, not at all.
When the diaphragm relaxes, the natural rubber band-like elasticity of your lungs and your chest wall just springs back.
It just snaps back into place.
The dome rises back up, chest volume decreases, pressure rises, and the air is passively pushed back out, just squeezing the bellows shut.
It's an incredibly elegant cycle of mechanical work operating tens of thousands of times a day. And while it pulls down to create that vacuum, it's also slightly flaring your lower ribs outward to make even more room.
So cool. Now that we have the bellows metaphor firmly in mind, this giant parachute constantly flattening and rising,
Yeah.
we have to look at what it's bumping into.
Because it's not empty space.
Right. You are not an empty plastic syringe. The inside of your torso is shockingly crowded.
What's fascinating here is how beautifully packed the human trunk is and how the diaphragm molds to the organs around it. The text points out that the diaphragm doesn't just have one perfect uniform dome.
Right.
It actually features 2 distinct domes, a right and a left. And the right dome sits significantly higher up in your chest than the left one.
Which, that feels like a design flaw at first glance. You would expect perfect symmetry.
You think so?
But it's forced higher because of the massive roadblock directly underneath it in the abdomen.
Your liver.
Yeah, the liver is huge. It's this huge, dense organ tucked right up under the right side of your ribcage. It acts like a giant boulder sitting underneath the floor of a tent, just physically pushing the right side of the diaphragm upward.
Then, to complicate the architecture even more, there's a visible depression right in the middle of the muscle between those 2 domes.
Why is that?
That depression exists because the pericardium, the tough sac containing your heart, is resting directly on top of the diaphragm.
Oh, wow.
The sheer weight and continuous beating of your heart literally presses down and permanently shapes the top of the muscle.
So to build on that tent metaphor, you have a giant boulder pushing up on the right side of the floor, and someone has dropped a bowling ball right on the middle of the roof.
That is a great way to picture it.
The tent fabric has to stretch and mold around these vital objects.
Let's look at those exact anatomical relations because they paint a picture of just how integrated everything is. On the thoracic surface, the roof of the diaphragm, it is in intimate contact with the pleura, the membranes wrapping your lungs, and the pericardium wrapping your heart.
So it's the floor your cardiovascular and respiratory systems rest on.
Exactly.
And on the flip side, the abdominal surface, it serves as the ceiling for your digestive and filtering systems. It's roofing the liver on the right, the stomach, and the spleen on the left.
Tacked further back toward the spine, it's capping off both of your kidneys and your adrenal glands too.
Think about the mechanical implications of that. Every single time you take a deep breath and that parachute powerfully flattens downward, your diaphragm is actively compressing and massaging your liver, your stomach, your intestines.
It actually aids in digestion and helps push venous blood out of those organs and back toward the heart.
Which introduces a monumental logistical problem.
Oh, the plumbing.
Yes. We establish this as a tightly packed, constantly moving physical barrier between the chest and the abdomen. So how do food, blood, and electrical signals get from the top half of your body to the bottom half without getting crushed?
Right, they have to cross the border somehow.
Exactly.
The barrier is selectively permeable. There are specific anatomical openings called hiatuses built into the diaphragm. The muscle is essentially pierced in 3 major locations to allow critical life support pipelines to pass through.
So medical students use a classic mnemonic to remember this plumbing layout.
Oh yeah, I remember this one.
Because I ate 10 EGGs, AT12. Let's walk through this, not as a memory quiz, but as a map of your internal border crossings.
Right.
The numbers refer to the levels of the thoracic vertebrae T8, T10, and T12, giving us the exact vertical coordinate on your spine where each pipe punches through.
Starting with the highest opening, I8. The I stands for inferior vena cava, and the 8 is the T8 vertebra level. This is the cava opening. It's a hole located perfectly inside the tough central tendon we talked about earlier.
Oh, right in the peak.
Right in the peak. It allows the inferior vena cava, which is the massive low-pressure river of a vein, return deoxygenated blood from your entire lower body back to your heart to pass through.
Got it.
It also provides a tiny side door for branches of the right phrenic nerve.
Moving down the spine to 10 EGs. The 10 is the T10 vertebra. And the EG's part points to the esophagus and the vagus nerves.
Yep.
This is the esophageal hiatus. It allows your food pipe, the esophagus, to pass from your chest into your stomach. It also lets the anterior and posterior vagal trunks slip through.
Those are the main neurological cables controlling your digestion and your resting heart rate.
Wow. Okay, and finally we reach the lowest opening, 80-12.
The 12 is T12. AT represents the aorta, the azygos vein, and the thoracic duct. This is the aortic hiatus.
Okay.
It allows the descending aorta, massive high-pressure highway carrying fresh oxygenated blood to your lower body to cross the border.
And the other vessels.
It also accommodates the azygos vein and the thoracic duct, which handles the body's lymphatic fluid drainage.
Here's where it gets really interesting though. When I first looked at this plumbing schematic, a giant red flag went up for me.
Oh, really?
The diaphragm is a powerful muscle designed to vigorously contract, shorten, and flatten out constantly.
Right.
If you have the aorta, literally the single most important blood vessel in your body, running right through the middle of this contracting muscle, why doesn't the diaphragm squeeze the aorta shut every time we take a deep breath?
Yeah, that would be bad.
It would be like stepping on a garden hose. We would literally cut off blood supply to our legs with every single breath.
It's the most logical fear to have when looking at this anatomy, and it reveals a brilliant architectural bypass.
How does it work?
If you look closely at the spatial arrangement, the aortic hiatus doesn't actually pierce the muscle fibers at all. The aorta passes behind the diaphragm.
It's tucked behind the wall entirely.
Precisely. It hugs the spine and passes behind a tough fibrous band called the median arcuate ligament.
That's protected.
Very protected. This tendinous arch forms a protective bridge over the aorta, so when the muscular fibers of the diaphragm powerfully contract and shorten, they pull against that fibrous arch, actually lifting it away from the aorta rather than clamping down on the vessel.
That is just phenomenal engineering. Blood flow remains completely uninterrupted regardless of how hard you're breathing.
Contrast that with the esophagus at the T10 level. The esophagus does pass right through the actual red muscle fibers of a section called the right crus.
Which is an equally intentional design, right? Because the esophagus passes directly through the muscle. When the diaphragm contracts and flattens during inhalation, those muscle fibers squeeze around the esophagus.
It acts like a physiological sphincter.
A built-in pinch valve.
Exactly. When you take a deep breath, you increase the pressure in your abdomen. That pressure naturally wants to force stomach acid up into your chest.
Oh, gross.
Yeah, but because the diaphragm pinches the esophagus shut at the exact same moment you inhale, it prevents that acid from washing backward.
So it's protecting the aorta from being crushed while purposefully crushing the esophagus to stop acid reflux. Incredible.
It really is.
But I mean, a muscle doing this much non-stop mechanical work, managing all these border crossings, and creating the vacuum of life, it requires a massive electrical grid and a heavy fuel supply.
Absolutely. Let's look at that power grid. The innervation, the electrical wiring of the diaphragm, brings us to another classic anatomical rhyme.
Let me guess. C3, 4, 5 keeps the diaphragm alive.
That's the one.
The motor innervation, meaning the electrical command telling the muscle to contract and pull the bellows open, comes entirely from the phrenic nerves. And the phrenic nerves originate way up in your neck from the 3rd, 4th, and 5th cervical nerve roots.
Think about the geography of that for a second.
It's pretty wild.
You have a muscle located at the very bottom of your ribcage, but the wires controlling it start all the way up near your throat.
So far away.
The phrenic nerves have to travel down your entire neck, navigate through the crowded chest cavity, pass the heart and lungs, and finally plug into the diaphragm from the underside of the abdominal surface.
The text also points out a bizarre quirk about the sensory innervation.
The split grid.
Yeah. Sensory wiring tells your brain about pain, or proprioception, which is the physical sense of where a body part is in space. The diaphragm has a completely split sensory grid.
Yep.
The central tendinous part gets its sensory wiring from those same phrenic nerves coming from the neck. But the outer edges, the peripheral muscular portions, send their sensory signals to the 6th through 11th intercostal nerves, which are local to the ribcage. Why the complicated split?
It traces back to our embryological development in the womb.
Oh, okay.
The diaphragm actually begins forming high up in the cervical region near the neck, pulling its nerve supply from there.
Wow, really?
Yeah, and as the fetus develops and the heart and lungs grow, the diaphragm is pushed downward to its final position, dragging those phrenic nerves all the way down with it.
Leaving this incredibly long trail of wire.
The clinical reality of this wiring is fascinating. Because the center of the diaphragm sends its pain signals back up to the neck via the phrenic nerve, your brain can easily get confused about where the pain is actually coming from. If you have an irritated diaphragm, perhaps a ruptured spleen leaking blood, or an inflamed liver pressing upward into the central tendon, your brain will often interpret that abdominal disaster as a sharp pain in your shoulder or your neck.
That is wild. Your spleen bursts and your shoulder hurts.
Oh, yeah.
It's called referred pain, right?
Exactly. And if we connect this to the bigger picture, the C3, 4, 5 wiring from the neck is both an evolutionary marvel and a profound vulnerability.
How so?
Because the central command originates so high up in the cervical spine, someone who suffers a devastating spinal cord injury in their mid-back will tragically lose the ability to move their legs or their trunk. However, they will still be able to breathe completely independently because the brain's connection to the diaphragm originates above the
The
damage.
signal still gets through.
Right. But conversely, a high cervical fracture and injury above C3 severs that specific wire.
Oh, no.
The diaphragm is suddenly disconnected from the brain, which is why high neck injuries are instantly life-threatening without the immediate intervention of a mechanical ventilator.
It entirely dictates survival based on where the wire gets cut.
Completely.
Beyond electricity, this non-stop engine needs fuel. The blood supply.
The blood supply to the diaphragm is beautifully redundant. It cannot afford to cramp or fatigue from a lack of oxygen.
Right.
The outer edges grab blood from local sources like the subcostal arteries and the lowest intercostal arteries running along ribs.
But the main fuel lines are the inferior phrenic arteries, feeding the muscle from underneath.
Yeah.
The text describes how these vessels form a highly redundant interconnected web near the vena cava and the esophagus. If one tiny branch gets blocked, the blood just rewraps through another part of the web.
It's so efficient.
And the top surface even gets topped off by superior phrenic arteries coming out the aorta. It's a backup system on top of a backup system.
You really need it for a muscle that never stops working.
So we have established how perfectly designed, wired, and fueled this boundary is. But biology isn't perfect. What happens when this complex border wall breaks down or malfunctions?
Let's talk about the clinical realities. We can start with a malfunction every single person listening has experienced. Hiccups.
The worst.
Right. The text notes that hiccups are caused by the involuntary intermittent contraction of the diaphragm muscle.
Is literally a spasm of your primary breathing muscle. And it is usually triggered by something incredibly mundane, like eating a large volume of food too quickly.
Remember that crowded tent metaphor?
Yeah.
Your stomach sits directly beneath the left dome of the diaphragm. If you eat a massive meal rapidly, your stomach forcefully expands, invading the diaphragm's personal space.
It bumps into it.
Exactly. The sudden stretch can irritate the muscle tissue or the vagus nerve passing right next to it, causing the diaphragm to violently jerk downward in a spasm.
So what does this all mean? It means your annoying post-dinner hiccup is your respiratory engine throwing a tiny mechanical tantrum because your stomach pushed it out of alignment.
Pretty much.
But the malfunctions can get far more serious than a spasm. The border wall can actually breach. In medicine, this is a hernia.
Herniation through the diaphragm comes in several forms. We discussed the esophageal hiatus earlier, the hole where your food pipe passes through the muscle.
Right.
Sometimes the structural integrity of that muscular pinch valve weakens. When that happens, the upper portion of the stomach can physically push upward through the hole, bulging out of the abdomen and into the chest cavity.
And that is a hiatal hernia.
Yeah, and it essentially destroys the physiological sphincter we talked about. Without the diaphragm pinching the esophagus shut properly, stomach acid freely washes up into the chest, causing severe chronic heartburn and reflux.
The source material also outlines far more traumatic breaches. Congenital and acquired hernias.
Yes.
Congenital hernias happen in the womb due to abnormal fetal development. The diaphragm fails to fuse completely, leaving a literal hole in the border wall before the baby is even born.
And the downstream effects of that missing wall are catastrophic for a developing fetus. The abdominal organs, the intestines, liver, and stomach take the path of least resistance.
Which is upward.
Right. They migrate upward through the hole and pack into the chest cavity. The lungs require empty space and negative pressure to develop. With the chest crowded by abdominal organs, the baby's lungs are physically crushed and fail to grow, leading to severe respiratory failure immediately upon birth.
Wow, that's terrible.
Yeah.
Then there are acquired hernias. These are not developmental, they're violent.
Very violent.
Acquired hernias almost always occur as a result of blunt force trauma, like a high-speed car crash or a fall from a great height.
This raises an important question, and it really forces us to visualize the physics of trauma on the human body.
Okay.
Your abdomen is essentially a closed, fluid-filled cylinder. Think of a sealed water balloon.
Right.
When a massive blunt force impacts it, say a steering wheel compressing the abdomen at 60 miles an hour, that fluid and pressure cannot simply vanish. It has to go somewhere,
But the downward path is completely blocked by the solid bones of the pelvis. The back is blocked by the spine,
leaving only one escape route for the pressure.
the diaphragm.
The force explodes upward, violently tearing the muscular border of the diaphragm. The sudden immense pressure turns a perfectly sealed abdominal cavity into a life-threatening spatial conflict, forcing the stomach and intestines up into the chest alongside the heart and lungs.
So it's an absolute emergency.
Oh, absolutely. It requires immediate emergency surgery to pull the organs back down and sew the parachute back together.
It is a stark reminder of just how fragile this incredibly perfect system can be under the extremes of physical stress.
It really is.
Well, we have covered a massive amount of ground today. We want to thank you for coming along on this deep dive journey with us, tracing the anatomy from the tip of the gyphoid process all the way down to the lumbar spine, and exploring the amazing engineering that keeps you breathing.
Before we wrap up, I want to leave you with a final puzzle to mull over, building on what we discussed today.
Oh, I love a puzzle.
The text notes briefly that alongside its primary role in breathing, the diaphragm works in tandem with your abdominal muscles to purposefully increase intra-abdominal pressure. You need to build this intense internal pressure to expel vomit, for defecation, for urination, and it is the primary mechanical driver for childbirth.
Right, closing the top valve while flexing the abs to build a massive amount of downward pressure.
But here's the fascinating contradiction.
What's that?
We established early on that the diaphragm is a skeletal muscle. In anatomical terms, skeletal muscle implies voluntary control. You consciously choose to flex your bicep or your quad.
Right, I'm doing it right now.
Right, yet the diaphragm governs processes that feel entirely involuntary. We breathe seamlessly in our deepest sleep without a conscious thought. We experience the sudden, completely uncontrollable reflex to vomit, or the violent spasm of a hiccup.
Wow, that's true.
It sits directly on the borderline of our autonomy.
So the question to explore on your own is, just how much conscious control do we really have over our own biology when our primary dynamic border wall, our internal pressure cooker lid, straddles the line so perfectly between our conscious voluntary desires and our deepest involuntary survival reflexes?
It truly is the ultimate dynamic boundary, structurally and neurologically.
It certainly is. Keep wondering about the machinery keeping you moving, and keep diving deep.